Department is pushing to overhaul regulation by making inspectors safety consultants for the same homes they're charged with overseeing. The idea is to improve care, but critics fear that it could compromise it. Here's investigative reporter Jackson Vanderbecken.
And this is completely changing and reforming how we would do quality and safety oversight.
That's the state top nursing home regulator, Heidi Steinecker, touting a plan to convert the state's 600 inspectors into consultants. Each would adopt and regularly visit 2 or 3 homes amid the COVID crisis to improve care while retaining their federally mandated oversight role. Steinecker recently told the legislature that during the pandemic, inspectors are visiting the state's 1,200 nursing homes more than ever before.
You're already noticing a big difference in the repeat places that we're going, as well as we're noticing a difference in the ability to minimize the amount of death in cases.
But while inspector visits are indeed up, nursing home care advocates cite records showing the number of citations is down dramatically, and they worry the new plan could weaken enforcement permanently.
This is a huge conflict of interest for surveyors.
Tony Chickatell is an attorney with California Advocates for Nursing Home Reform. He says under the state plan, surveyors would be put in the awkward position of citing the same facility they or their fellow regulators had been advising.
Which will, of course, give surveyors incentives to not find problems, because anytime there are problems, it's going to make them look bad as opposed to the facility.
Chickatell says that approach had been used nationally during the 1980s, but the law was changed after the Institute of Medicine, a government policy advisory group, concluded that the approach undermined the state's ability to eliminate substandard providers and deter marginal facilities from repeating violations. Going back to the consultation model would be especially bad timing now, Chickatell says.
It's happening during a pandemic when we need strong enforcement more than we ever did before.
But some say a change is overdue.
A lot of times the surveyors will be more of a gotcha.
Dr. Mike Wasserman is president of the California Association of Long-Term Care Medicine. He says citations are all about laying blame, not getting to the root of problems.
The incredibly dedicated frontline staff are often left in tears or with broken morale after a surveyor comes into a building. And that part of the process needs to be dealt with.
The union representing the surveyors would not comment for this story.
They aren't interested in being consultants.
But Lisa Coleman, executive director of the state's Long-Term Care Ombudsman Association, says state health care inspectors she has talked to feel caught in the middle.
The surveyors, by and large, do not like this. The surveyors feel like this is a conflict of interest for them. The surveyors don't like the idea of being consultants. If they wanted to be a consultant, they would be doing a different job.
The state hopes to work out the final details of the plan within weeks. Jackson Vanderbecken, NBC, Bay Area News.
Up next, crews search for them for 8 days and find